Hi everyone, I'm going to talk about your core in this video and how something called your anticipatory core works. Now your anticipatory core are the core muscles and part of your body that prep you for movement. So they engage as soon as your brain has decided that you're going to make a movement. So it happens on the subconscious level. And they work together in a coordinated effort to prepare you to move efficiently. Now if these muscles aren't working efficiently, you'll still be able to execute the task, but eventually there will be fallout. And we see this in the form of decreased performance, so maybe losing speed, not kicking as far, not having the same amount of power. We see it show up in pain, so having back pain, hip pain, knee pain, neck pain, shoulder pain, depending on what you're doing. And then we also see it in our female athletes as something else called stress urinary incontinence and urge incontinence. This is not reserved for women who have had babies. It happens in collegiate athletes and youth athletes as well when they're not managing the pressure system. And men will have symptoms in a different way, but still can experience similar issues with their pelvic floor function. So I just gave away one of the muscles. So the three muscles that we're going to talk about are your diaphragm, which lives in the rib cage and helps you with breathing. And then your transverse abdominals, which are the deepest layer of the abdominal wall, and they attach from the rib cage down to the pelvis, and they wrap all the way around you and attach at the back through fascia. And then your pelvic floor, which I'm just going to back up a little bit more, which is between your legs, so it goes from your pubic bone to your tailbone, and it's like a hammock between your legs, and it supports your internal organs, and then it also, through fascial attachments, attaches to each hip. So those three muscles make up something called your anticipatory core. And I just want to say that I learned this, which I'm going to teach you, from Julie Weave, physical therapist in California, and I'm going to put a link to her website, because if you're a healthcare provider and you watch this and you want to learn more about it, I highly recommend seeking out her courses. So I just put my balloon down, so I'm going to grab it. Okay, so we're going to talk about these three muscles, and they make up your anticipatory core. And we're going to start with the diaphragm. So as I said already, the diaphragm helps with breathing. So when you breathe in, the diaphragm pushes down, and you can see that the pelvic floor and abs expand, and when you breathe out, the diaphragm comes back up, and the pelvic floor and the abdominals contract and lift. So breathing in, everything's expanding. Breathing out, it's coming back together. A little bit difficult to see on this balloon. So when you breathe in, diaphragm comes down, pelvic floor lengthens, abdominals lengthen. When you exhale, the diaphragm comes back up, the pelvic floor contracts and lifts, and the transverse abdominals contract. And this works in a coordinated effort automatically with every breath. And then it preps you for movement as well. If we have issues somewhere, if we have inefficient movement patterns, if we have pain, if we've had any kind of shoulder, abdominal, hip, knee, any kind of surgery, especially in this area, we will have dysfunction in this system, and it will be contributing to any pain problems that you're having or performance problems that you're having. So what I want you to do, so in order to access this part of your core, you need to use your breath. And this is Julie Weave's big thing. And she integrates this into movement and training. So you're not just doing core exercises to rehab your core, you're really putting it together with all of your movement patterns to build in that automatic piece of it again, which was happening automatically before you ran into trouble. So to access the system, we use our breath. So what you're going to do is we want the lower ribs moving, okay? So there's a lot of talk out there around, upper chest breathing and tummy breathing being what connects you to your diaphragm, and it does, but it's a lot more than that. So we know that if the lower ribs are moving, that's where we get the most movement from our diaphragm. Now, we tend to either breathe up into our chest because we're always stressed, or that's our posture that we've adopted, which often goes with stress. That's where it's easiest to get the air. And then tummy breathing, also belly breathing, if you're doing too much of that, so more tummy breathing than the other parts, again, can be influenced by posture or way you've learned to breathe, or because you have a restriction somewhere else. So we want to understand our own breath first, but that is where you're going to learn a little bit more here. So the lower ribs need to be moving well so that we know that that diaphragm is moving well. So we're going to focus our attention on that. It doesn't mean that your chest or your tummy aren't going to move at all, but if you're not getting any movement through here, we need to start getting some movement through there. So you can put your hands on your ribs and feel, but you just want to make sure that you're not hiking or that you're not arching when you're doing that, because you want to stay nice and stacked. So if you're in this position, you're going to breathe into here. If you're here, you're going to end up breathing more into your tummy, okay? So you want to be stacked with that rib cage stacked over top of the pelvis, all right? So here, I'm going to breathe into my chest. Here, I'm going to end up breathing into my tummy. And neither of those positions puts me in a great position to recruit my core. So then you're going to think about breathing in 360 degrees. So this should be a gentle breath. So breathing in. And you just want to feel those ribs expanding 360 degrees. So Julie Wiebe calls this the umbrella breath. So that the bottom is opening and closing more than the top, okay? So sometimes you can put your hands like this and you can feel. So that when we're breathing in, those lower ribs are opening, and when we're exhaling, they're collapsing down, but we're not getting any tightening of the abs to help with that breath out, okay? Your abs don't need to help you breathe when you're doing just a gentle breath like I'm doing now. They will help you breathe when you're at full exertion sprinting, but not right now, okay? For some of you, you're going to have to consciously learn how to let your abdominal muscles go because you've trained so much for them to be held tight. So the next piece you will do, and now if you're struggling with this breath, what I want you to do is try leaning forward a little bit and see if that's a bit easier, and also shifting the weight over your feet. So just checking in, like, do you feel the weight in the heels, the toes? Is it even over your foot? And if it's not, just try to make it even and maybe lean forward slightly and try the breath and just see how that feels. Some of you will have to lay down and learn how to do it there, and I'm going to do that in a separate video. So if you're not feeling it when you're standing, then I want you to check out the piston breath laying down, okay? So the next thing when you've got that nice gentle breath is you're going to think about your pelvic floor muscles. So your pelvic floor is like a hammock between your legs, and the one of how we learn to connect to those muscles is thinking about their physiological function. So they help control bowel movements and urination. So you're going to think of those cues to connect to those muscles, and then once you've connected with them, we're going to use a slightly different cue. So what you want to do is, for males and females, we're going to say that the front pelvic floor is like stopping the flow of urine, so holding in your pee, and the back is like holding in a fart. So all I want you to do is just try and squeeze the front or the back and see which one feels easier to do. Okay, once you've got that, pick the one that feels easiest, and you're going to start with that. But ideally, you need to be able to do both, and you need to be able to coordinate them together. And so you're going to start with your breath. You want to make sure you have that standing position where the weight is equal over your foot. Start in the position where you felt the breath was easier. And you're going to breathe in, so doing that umbrella breath. And you're going to think about your pelvic floor, the front or the back. You're going to think about it lengthening and opening. So there are sphincter muscles that close, and then there are other muscles that help lengthen and lift. And so it's going to be the opposite of stopping the flow of urine, but not pushing, just letting go. So you're going to do that breath in, and just let the tummy lengthen and let the pelvic floor lengthen and open. Then just do a gentle exhale. And you're just going to practice that for a bit. Okay, again, not pushing the pelvic floor. There shouldn't be effort, but your brain should be working pretty hard right now. Once you have that, then you can add the pelvic floor lift. The key, though, is always the inhale and lengthen, because often the way we're training is always tightening things and contracting things, And so it's really important for normal muscle function that you have the lengthening ability of the muscle. We run into trouble when we can't lengthen our muscle or relax our muscles properly. And it's no different for your core. So imagine your pelvic floor is like your bicep. You need to be able to lengthen your bicep in order to pick something up and bring it to your mouth again. So if you walked around all the time like this, you'd never be able to pick anything up. So you'd had a dysfunctional arm. It wouldn't be able to work for you. So your pelvic floor is the same. You need it to be able to lengthen, and then it will contract again. Okay, so if you're feeling stuck with this, just work here. Work on the breath, work on letting go. If you do that, you will get the reflexive contraction from the pelvic floor and the abdominals. Okay? If you feel like you've got it, or we've worked on this together before and you want to go to the next step, I'm going to explain it. So, umbrella breath, inhale. Letting the pelvic floor lengthen and open. Then you will start your gentle exhale. And you will think about closing and pulling up inside of you. Now, if you are female and you're thinking about the front, you're going to think about closing around a blueberry and gently pulling up inside of you so you're not crushing the blueberry. If you are a male, you're going to think about lifting the base of your penis for the front. The back pelvic floor, you're both going to think, males and females, about the same thing, but you're closing and gently pulling forward on an angle towards the pubic bone. Okay? So whereas the front is more up, the back is going to be more drawing towards the front. And the action is close and pull up. Okay? So, inhaling, lengthening the abdomen, lengthening the pelvic floor, starting your gentle exhale, and then gently closing and lifting either the front or the back. And this is where you would practice. And then when you feel like you're getting it, move on to trying the other. So if you start with the back, try the front. If you start with the front, try the back pelvic floor. And then try them both together. Okay? If you haven't had surgery on your pelvic floor or your abdomen, you might connect to this quicker because there won't be issues in how the nervous system is connecting to those muscles. And if you're feeling like you just can't get this, it's okay. That's a very common place to be when you're first starting to learn how to connect to these muscles. Just be patient and work on it gently. So you're not going to be an A+ student, you're going to be a C student, okay? Now the next thing after you've got that feeling is putting it with movement. So the inhale is getting us that lengthen, and the exhale is getting us the contract and lift. So we want to start training on our exhale, and that is because we've then prepped that system for movement. If you're having problems with that system, it's likely not preparing you for that movement. So that's why we're going to do it that way, versus like, I'm going to squeeze my core and turn my abs on and then move. It doesn't create a dynamic foundation, and it won't serve you in all the various movements that you need to do. So we can put it with a squat. So you're going to stand in the position where you feel the most connected to your breath and your core. And then you can inhale and lengthen the pelvic floor as you're squatting down. So, and then at the bottom, I'm going to start my exhale. And I'm going to close and lift my pelvic floor and stand up through the exhale, okay? That's how I would start. If I were lifting something, I would breathe in, lengthen, start my exhale, and lift, okay? So you're going to move on the exertion. You're going to start your exhale and then move. And you can put this in with any exercise or functional movement that you want to do. You do have to slow it down at first because you're teaching your brain a new way to move. And so you need to do really good quality practice of those. Otherwise, you just keep practicing the way you were doing it, the strong pattern that your brain has, and you're trying to give it a new pattern, okay? So if you're thinking, whoa, how could I put this into my exercise program with everything? You don't have to put it in with everything. But if you pick one or two exercises at the beginning or in the middle of your workout, and you do them a little bit slower with this focused breathing or conscious breathing, your system will be primed to be more connected for all the other movements that you're doing, okay? So the goal isn't that you have to integrate it with everything. The other time you want to integrate it is if you're doing, or you want to concentrate on it, is if you're doing a lift or movement that either causes you pain, causes you symptoms, or you're not recruiting. So like maybe your glutes are never sore from all your squats. Chances are you're not connecting well to your pelvic floor and your transverse abdominals, so then you're not recruiting your glutes well, and so you're not getting them involved in that movement. You shouldn't have to think, I must activate my glutes to come up through a squat, okay? But that's my opinion. All right, so takeaways. You want to be able to do that umbrella breath 360 degrees. You want to be able to lengthen the pelvic floor and the abdominals on the inhale in order to prepare them for movement. And then you want to move on the exhale. So even if you haven't been able to feel your pelvic floor today, if you just start with the breath, inhaling to lengthen and relax, and starting your exhale to move, you will be connecting to your core. This has been shown in many research studies, and if you want more information, check out Julie Reeb's website. So those are the takeaways. If you have questions, you can message me. I'll do my best to answer. If standing wasn't working, then check out the laying down video.